Hospital administrators have to understand your job is to run the hospital, but without the people in place, your job is not needed.
Largest nurses' strike in city history. They're picketing for more pay after union negotiations failed. Now hospital officials say they will do whatever is necessary to minimize disruption for patients.
They are fighting for that better pay and also for safer working conditions. And this all follows months of negotiations which failed to produce an agreement, and it all led up to today, a strike.
So what does this mean for patients now, Rhiannon?
What this means for patients, right? Super important. Staffing ratios are going to be much worse, right? What does that mean? When you go to a hospital, let's just say there's one nurse for 10 people, or 12 people, or 15 people. Let's say 15 people on a staff. It could be half, right? The other thing that's important is that when we had these problems in the past, hospitals would just reach out to staffing firms. And so let's say you're in New York, they just hire nurses from Virginia, from a staffing firm, to come right in and be put in place. The problem is now, without the extra grant funding, we can't do that, right? So what happens? People don't go to work, there's no workers to come. There's nobody, there's no pool to pull from because they can't pay this nurse 100 grand. The staffing agency gets 240 for the same 100 and pays that nurse 150. These are real numbers. This is how this really works in the staffing. That model no longer works in hospitals long term. The funding has been cut. There's no way to actually help the people who have emergencies. So now you look at a hospital. Doctors don't sit at bedside all day. They come in, they make assessments. For the most part, they leave, right? You have some specialty or hospitalists who are there, but they're not at the bedside all the time like the nurses are. So I see extreme care deficiencies in the short term and in the long term, which will affect a couple things. And hospital administrators, I'm gonna talk to you because, of course, I know the business of healthcare. How billing works for you all, right? Let's talk about the money part, because this is what you need to know. The nurses now know they have leverage because they're watching my videos and they're gonna continue to share it. But if you all don't have nurses at that bedside, there are certain things that you can't bill for because you don't have anyone to actually do the service. So we're complaining about not making enough money. But again, I go back to my last video. Hospital administrators have to understand your job is to run the hospital, but without the people in place, your job is not needed. It's literally not needed. There's nothing to run. I want us to come together on this, but most importantly, for the nurses that are out in New York, I'm with you guys in solidarity. And for the people who are out there, bring them some water. I love y'all.